And now it's time for a message from our sponsor, the National Diabetes Volunteer Leadership Council and Diabetes Patient Advocacy Coalition. Please welcome George Huntley, president of NDVLC.
Hi, I'm Jim Shella, and I'm here with George Huntley, who is with the National Diabetes Volunteer Leadership Council. George, tell me, who belongs to that organization and what does it do?
The NDVLC is a group of experienced leaders in the diabetes community that have come together to advocate on behalf of patients with diabetes. We're also excited to announce that we are now formally affiliated with the Diabetes Patient Advocacy Coalition, which is an organization that does grassroots advocacy through thousands of patients throughout the country.
I know you've been involved in diabetes charity work for a long time. Tell me about your personal ties to diabetes causes.
Sure. Well, I've been living with type 1 since 1983. I have a sister, niece, and great-nephew also living with type 1, so it's clearly a genetic issue. I was a volunteer with the American Diabetes Association since 1986, and I was privileged in 2009 to be the national chair of the board. In my day job, I've been the plan administrator of a self-insured health plan since 1997, so I have the payor and the employer side of the healthcare system as well as the patient and payee side.
And you and I have known each other for about 20 years, and you know that I have raised 2 children with diabetes, so I'm very familiar with it. For those people watching, please share what it's like to live with diabetes.
Yeah, sure. It is a 24/7 disease. I wear an insulin pump that gives me insulin every 5 minutes. I also bolus every time I ingest carbohydrates. Everything I eat, I have to take an extra dose of insulin for. I wear a continuous glucose monitor that allows me to see what my blood sugars are through my telephone, that shows me what my sugars are so I can adapt to my insulin take so I can maintain my blood sugar levels appropriately.
We're all living through this pandemic, but it's a bigger concern for people with diabetes. Explain that.
So people with diabetes like myself are all scared during this pandemic. We are no more likely to get COVID-19 than the general population, but we are far more likely to have a severe illness or mortality or die because of it. And the African American and Latino populations are far more likely to have that severe illness or death than the general population. So for people with diabetes, we're on edge. We are not going out. We are trying to do the right things. And my counsel to them is to socially distance, wear a mask when you're in public, wash your hands, but also keep a reserve of medicines and supplies so that you can withstand a long quarantine, especially if you develop the disease.
Yeah, and the cost of insulin is a big concern for a lot of people with diabetes, and it's hard to build up a reserve. That has to be an issue.
Well, it's an expensive drug, and it's a concern, especially as people are losing their insurance through this pandemic. 1 in 3 adults with diabetes are actually on insulin. So the good news is all the manufacturers do have patient assistance programs. Lilly has stepped up with a $35 a month program, so you can get a month's supply of insulin for $35 through their solution center. They've also signed on to the Medicare program that will start in 2021 for $35 a month insulin. Novo Nordisk has come out with free insulin, a free 90-day supply of insulin for anyone who's lost their job through the pandemic.
So this is being done, this video that we're creating, to help let some of the people in Congress know what concerns are and what problems need to be addressed. What can Congress do to make life better for people like you?
Well, during the pandemic, it has really exposed massive gaps in the healthcare system. And so there's been waivers that have actually helped bridge those gaps during this time, and we need to have those waivers made permanent. For example, 90-day supplies of medication so people can build up a reserve. That's been a waiver that needs to be made permanent. Telehealth is now getting paid for by Medicare and many private insurers. That's why people are using telehealth. But healthcare providers and healthcare systems aren't going to invest in the technology for telehealth unless it's made permanent.
So people with diabetes are afraid during this coronavirus, and apparently I too am afraid of the camera. And unfortunately, I omitted a very important point with regard to waivers that are happening during this pandemic that are granting people with diabetes access to important things. The area that I omitted was access to medical technology. Medicare has issued a waiver that allows doctors to prescribe a patient access to a continuous glucose monitor simply by medical necessity. Now, it shouldn't take a waiver for a doctor to be able to prescribe something based on medical necessity, but prior to that waiver, A patient with diabetes on Medicare needed to prove that they were testing their blood 4 times a day. However, Medicare itself would only pay for 3 test strips a day for a person with diabetes on insulin. That may not sound like much, but in 2017, 91% of patients on Medicare with access to a CGM were white. 91% were white. Clearly, we have an access issue. Clearly, there's a treatment bias issue going on. All of these issues need to get addressed, but the waiver that eliminates some of those barriers needs to stay in place.
Even prior to this pandemic, the number one reason a patient on Medicare would miss a doctor's appointment was lack of transportation.
So this goes beyond the pandemic.
Yeah, it certainly does. We need to really address full-scale health reform in this country. We need to stop medical bankruptcies. We need to stop financially forced rationing of treatment and care. People with diabetes, along with the rest of America, need access to real affordable health care. Not with pre-existing conditions, just real affordable health care that is not a privilege based on race or socioeconomics. An African American with diabetes is 3 times more likely to have their legs amputated than a white person with diabetes. And that is driven by the 14 states that did not expand Medicaid after the Affordable Care Act. We also need to pass through rebates at point of sale for all the patients. If I buy a vial of insulin and pay $350 for it, my insurance company or the federal government should not make a $250 profit based upon the fact that I bought that vial. It's reverse insurance. The sick should not subsidize the healthy. We need to work on these things. We also need to eliminate surprise medical bills. 1 in 6 hospital stays in the United States result in at least 1 out-of-network charge. That means the patient is faced with a charge that their insurance may not cover. That needs to also go away, and only Congress can fix that.
All right. Now, I know you have sponsors in this endeavor. Who are your sponsors?
I'm very happy to thank my sponsors because without their help, this would not be possible. And I'd like to point out some of the things they're doing during this pandemic to help the country. Eli Lilly, as we mentioned, has $35 a month insulin, but they also have 2 antibody treatments in clinical trials right now. In addition, in their hometown, in our hometown of Indianapolis, Indiana, they have made drive-through testing available for all healthcare workers during the pandemic, and they've opened up their research laboratories to process those tests. So thanks to Eli Lilly. Dexcom, who makes continuous glucose monitors, has donated 10,000 cell phones to hospitals across the country. That allows remote monitoring of patients with diabetes in the ICU, so the healthcare provider can see it without going into the patient's room, without going through additional versions of PPE. They've also donated PPE in their local communities of San Diego, California, and Mesa, Arizona. Abbott is leading the way in testing. They have several tests for the COVID virus, as well as several tests for antibodies, which will hopefully come into play as vaccines become available. Merck has 2 vaccines under development and several other drugs for treatment. So we're all hoping that all of these life sciences companies can be successful and help us move past this pandemic. I also want to thank you, Jim, for your time today, and Steve behind the camera for your time and volunteering to make this happen, because it's really important that this message get out. And thanks to the viewers for watching and listening to what this program and all the information the panelists have offered.
Well, thank you, George, and good luck in this effort.
Thanks.
Well, George and Jim, thank you for that. I'm not often complimentary towards these kinds of things, but I learned more from that segment about what's going on than many others. So that was a great, great discussion. Thank you.